So what is this Glasgow Coma Scale and who found this and in which year this came into existence into this world? Okay. So before entering into this term comes from the another greater term, that is the assessment of the level of consciousness. Yes. Of course, we need to assess the level of consciousness on how the patients are developing. This Glasgow Coma Scale majorly connects with the head injury conditions. Okay. Now, I am entering into the introduction of this Glasgow Coma Scale. Now, it was developed in 1974 by two great scientists, that is T. and Janet. And these two scientists developed that three categories of assessment will help to find out which stage of brain damage has the patient went under. Okay. Now, we are entering into the three stages of the Glasgow Coma Scale. First one is the eye opening. Absolutely, if a patient is going for a brain damage or head injury in an RTA, first we need to check out to the eyes, and next other categories will be following the eyes. How is the working of the eyes? If the two-wheeler is going in a fast, it is getting crashed and going for a road traffic accident. If the paramedical members and medical members are assessing the patient, first the checkout is the eyes opening. In four categories, they will give the scorings. First, four is the spontaneous, according to speech, according to pain, according to none. I am going to explain what are the four categories. If the patient is responding is to the eyes movement, opening his eyes and seeing here and there, it is spontaneous, he is very much good and better. If according to the speech, if the patient is lying down onto the road, paramedical members are asking, get up, like that, and based on the speech, the hears the sound and eyes open, and this concept works for the third stage of scoring. And second stage of scoring deals with the pain. It is responding to the pain onto which area we are touching on. Onto the touching of the painful area, the eyes open and see here and there. Based on this, we give the score 2. And one is none, even though responding to the speech, even though responding to the pain in any area, the response will be 0 and the eyes opening will be 0. Now, going for the second one, the verbal response. How the patient after an accident is responding in their own words. Classified on 5 topics: oriented, confused, inappropriate words, incomprehensible sound, and this none. Now, if the patient is speaking fluently, it is oriented. Is okay or she is okay even after the RT. Confused speech. I am asking, what date is it? What day is this? And the patient keeps on thinking whether it is morning or evening, whether it's a Thursday or Sunday, or like that, the confused sound. We give the scoring as 4. Inappropriate words. If I am asking, what is your name? And he is going to say some other words. Okay? So these types of inappropriate word communication, that is, we give the scoring 3. Incomprehensible sounds. Here, no words will be arising, only the sounds. This sounds will arise based on the amount of pain. Even though we are asking what is your name, what is the certain questions we are asking, day or date or anything, the sounds based on the pain they will express. We will give the scoring as 2. And one is none. Even after the complete analysis, touch or speech or anything, the verbal sounds from the patient is not coming. It is considered as 1, that is none. And the most important category is the motor movement. After falling from a bike or anything, road traffic accident, the motor movement plays a major role. The motor response. Making the scoring as a 6. From 6 to 1, obeys to the command. That is, if I am asking the patient to get up, okay, it is okay, you get up from the road. The patient spontaneously gets up Okay. Now, localized to pain. Fifth one is the localizes to the pain. If I am touching to the area of the pain, bruises, he's saying, okay, I am having the bruises here, and based on that, he's responding, his motor response is working, that is fine. Fourth one, vitreoscopy. If any open injury or blunt injury, if the paramedics are touching that, the withdrawal from that area is happening. Abnormal flexion, extension, and these categories will be working out in the paramedics or the medical professionals will be touching out the flexion and the extension in abnormal category will be arising. And last one is the none. As we all see in the none cases, this is also considered as a zero. This is the most classic patient. 13 to 15 is the mild brain damage based on the scores. 9 to 12 is moderate. 3 to 8 is severe. Hope you all understood this Glasgow Coma Scale in this wide stretched of analysis in the manner. So we'll meet on the next video with a detailed review. Thank you.